Hello, everybody. I am so excited for today's webinar. It is going to be one of the best that BTL has hosted. I am Sam Patel, and it's a pleasure to be with you all. Wherever you're tuning in from around the world, it's maybe the evening for you, maybe the morning, maybe the middle of the night. But we thank you so much for joining us for this brilliant, brilliant panel that has joined us and you to give you so much expertise for technology that's been around, but continuously advances, because that's who BTL is, always advancing and always leading the industry with cutting edge technology, with cutting edge protocols. And we're going to dive into all of that today. Once again, my name is Sam Patel. I am from Chicago, Illinois. I have owned and operated the BTL technologies at my different practices and have really grown fond of this wellness and aesthetic initiative and men's and women's health. And I cannot wait for you guys to hear from true experts around the world that have tuned in to help us understand this topic better. I now serve to be one of the clinical investigators for BTL as a consultant as well, helping BTL customers all around the world integrate these beautiful technologies into their practice. Now, let me take a moment to introduce this brilliant topic that we're going to be going into. We're going to discuss amazing topics with EMSELLA, a technology, as I mentioned, that's been around for some time, but a technology that always gives more. Now, as we embark on this journey together, I want to quickly introduce this expert level panel that we are so blessed to have and that I am very honored to moderate, starting with Dr. Carolyn DeLucia, board certified OBGYN from New Jersey. She is a global expert in female sexual health and regenerative medicine, offering advanced treatments like FemiLift and the O-Shot. She is a best-selling author, international speaker, and founder of The Secret Orchard, which she trains practitioners worldwide. Now, it only gets better from here, guys. This is amazing. We have also an author, another one, Dr. Judson Brandis, and he is a board certified urologist and nationally recognized authority in men's sexual health, known for his innovative work at Brandeis, MD, and academic ties to top institutions like Harvard and UCLA. This is a phenomenal individual that has joined us to help lead not just this discussion, but he also leads clinical research and educates physicians nationwide on topics such as sexual wellness and medical aesthetics. A good friend of mine, Dr. Patricia Wallace, has blessed us with her presence this evening, and she is a board-certified gynecologist and pelvic surgeon, specializing in pelvic disorders, incontinence, and hormone-related sexual health. She is the founder of Center for Pelvic Health and Wellness, leading pelvic health initiatives in Mission Hospital, and brings a holistic approach to care, including yoga for cancer recovery. So, Dr. Wallace, always amazing to see you. And last but not least, we have Dr. Sherry Kaplan. I had the honor of meeting Dr. Sherry Kaplan recently at a BTL event and was blown away with just how she operates her practice, how she integrates her specialty as a board certified specialist in integrative and regenerative medicine, focusing on hormone health and sexual health. She's the founder of Vitality MD. You should definitely follow them. They have a brilliant Instagram, and she blends traditional and holistic care, and widely recognized for her pioneered work of the O-Shot in Canada. So we have all of North America represented, and we are going to be diving into these amazing topics. So let's go into it. Now, why is this topic important? Why is EMSELLA even around? Why did BTL create this fascinating technology? Well, it's a very simple answer, and the answer is this, is that there's a need for it. Very simplistically, there's a demand for it. It's an unspoken category of medicine. It's an unspoken category of wellness. When we think about intimate health, it's a very intimate conversation. When we think about urinary incontinence, it's a conversation that unfortunately isn't had. And this conversation has to be had, and we're going to have it tonight because you can see the landscape of urinary incontinence. This is showing how every single year that progresses, we're starting to see more and more and more people have this concern, have this obstacle, an obstacle that we can well treat with technology such as the EMSELLA. And this is such an important conversation because you can see the average age of individuals that deal with urinary incontinence is 46 years old. That's very young. So we have younger individuals, middle-aged individuals, our elderly population that's growing more and more older as we go into the future. Our largest population of elderlies that we've ever had in our entire generation of humans. It's time to provide a solution. It's time to step it up as healthcare providers. And that time is with EMSELLA. That time is now. Talk about the industry impact and obviously the revenue that it can bring, not just to the world of urinary incontinence and the landscape, but to your practices. This is something that I learned about that I was not okay with. There is more adult diapers sold than baby diapers. And that is something that we have to pay attention to. If we go to the grocery store, I encourage all of you to take a look. That is because we haven't had solutions. We haven't had proper solutions, but EMSELLA is that proper solution. It's time to bring this to our patients. So we have the chance to change the statistic way here. I want to invite Dr. Brandeis and Dr. Wallace to kind of walk us through why is this pelvic floor so important, the muscles of the pelvic floor. We know different pieces of anatomy, such as the facial anatomy, such as body anatomy, but pelvic floor anatomy is almost this mysterious topic. Dr. Wallace, Dr. Brandeis, can you please walk us through a little bit more about the pelvic floor and walk us through your knowledge?
Women and men have exactly the same pelvic floors, and I think that women are a little more aware of the fact that they have pelvic muscles down there. Men probably less, and Dr. Brandeis is going to speak to that for us. But, sort of that pelvic floor being the foundation of our core, stabilizing the trunk over the lower body, has so many important functions, not just continence, but so many other things. Do you want to speak to that, Dr. Brandeis?
Sure. For me, the pelvic floor is like a hammock that hangs off the inside of the pelvic bones. And it's actually a combination of about 6 or 8 different muscles. But in men, the critical muscles are the pelvic floor, which consists of the internal and the external sphincter. So there's a sphincter above the prostate at the bladder neck called the internal sphincter. And then there's the external sphincter, which is at the bottom of the prostate. Then there's the detrusor muscle. So the muscles, especially at the bottom of the bladder, which in protocol 2 with the EMSELLA, you actually get some detrusor strengthening. And then the other set of muscle, which most people don't really know about, but are very important, are the ischiocavernosus muscles and the bulbocavernosus muscles. And those are the ejaculatory muscles. And so, in my studies, I've been able to show, we didn't take measurements, but the intensity of ejaculation for men is much greater because we're strengthening these ischiocavernosus and bulbocavernosus muscles, which are extremely difficult to strengthen on your own.
In women, the pelvic floor is this basket weave of muscles, just like in men, and we have over 600 skeletal muscles in our body. So these specific skeletal muscles, the pubococcygeus, connecting the pubic bone to the coccyx, which is the tailbone, the iliococcygeus, the puborectalis, which actually is a sling muscle around the rectum connecting to the pubic bone, which actually helps with anal continence as well. And then the transverse perineal muscles. These are all intimately involved in not only our posture, our continence, but in women also orgasmic function.
Absolutely. That's extremely important. And women also have that ischiocavernosus and bulbocavernosus muscles that help with orgasm.
Mm-hmm, mm-hmm. And in women, the urethras are really short compared to men, but the intrinsic, sphincter and the external sphincter are also important in continence, but those are really difficult muscles to actually strengthen. So we tend to rely on the outlet muscles to keep us continent for the most part, and then the support of the urethrovesical junction.
Exactly. And in men, continence isn't typically an issue, but when you have prostate cancer surgery and you remove the prostate and you're basically compromising the internal and external sphincter, that's when strengthening those muscles becomes critically important.
Absolutely.
And I think that this conversation already has started out brilliantly because Dr. Wallace, Dr. Brandeis, we need to have you guys teaching every medical student because this is the things that they don't teach us. They make us memorize anatomy, but not how that impact of that anatomy is for both men and women. Walk us through a little bit more about sort of how we've traditionally dealt with maintaining the tonality and the strength. As you mentioned, the sagging hammock. How do we pull the hammock out? What have we done traditionally before EMSELLA existed? Walk us through sort of the conversations we've had previous to the world of EMSELLA.
Well, about 30% of women are going to have some sort of urinary incontinence complaint after their first childbirth, even at year 1. And that just will continue on. Most women are not really thinking about their pelvic floors until they have an issue, and certainly men as well. But traditionally, we're going to talk to our patients about, are you doing your Kegel exercises, which are pelvic floor contraction exercises? And I will tell you, I examine women every day. And 7 to 8 out of 10 women cannot do a proper pelvic floor contraction. They just don't have the mind muscle connection. So therefore, we'll refer them to physical therapy to get that mind body connection. But the bottom line is bodybuilding the pelvic floor is so difficult, even if you were to do Kegels all day, every day. And that's where EMSELLA really has a unique role in, as I talk to my patients, this is a bodybuilding exercise.
You know, absolutely right. I think that sort of we've always had limitations with what advice we can give. And a lot of it's just wishful thinking. We give this advice, and are the patients actually going home and doing it? Are they actually going to physical therapy? Compliance is low. And so if we can provide an efficacious result in a very short amount of time without having to wait months and months and hoping for the best, that's where this conversation gets exciting. And I would like to kind of continue that conversation with learning more about EMSELLA, how it works. And I would like to kind of involve, of course, Dr. Wallace and Dr. Brandeis, but also Dr. DeLucia in regards to walk us through, if it's our first time tuning in and we're new to the world of EMSELLA, or maybe we know what EMSELLA is, but we want a refresher. Walk us down on how this technology even works in comparison to what we're used to.
Go ahead, Dr. DeLucia.
I'm happy to join in here. The way EMSELLA works is that it uses high FEM technology, which is high intensity focused electromagnetic energy, making 100% of the pelvic floor muscles contract. That's way more than you can do on your own. So those are called super maximal contractions. If I were to pick up a weight and I tried to do a curl, I can only fire 40 to 60% of my muscle fibers. But with high FEM, you can contract 100% of those fibers in that pelvic floor, which I don't call a hammock. I call it the cradle of civilization. It's where it all begins. So that pelvic floor is precious and it must be maintained. When you fire 100% of those muscle fibers, what we have found from the other EMSculpt procedures that are available for the abdominal wall, which are contiguous to the pelvic floor, is that you will increase not only the number of muscle fibers, but the size. And that is what sets this technology apart from anything else on the market.
I don't know who could have said it better. That was brilliant. I love the analogy as well. I'm learning a lot. You know, I know you guys very well. I've heard it, and I feel like every time, even us as the educators are always learning. Dr. DeLucia, that was brilliant. Beautiful. Thank you so much. I would like to continue the conversation with you, actually, if you don't mind, with walking us through sort of twofold. How, from a patient standpoint, is this approachable? Because it's, you know, listen, intimate health, urinary incontinence is a very delicate topic, and a lot of these things have surgical opportunities, which are good, but majority of the people don't want surgery or can't do it for whatever reason. And then further, from a business standpoint, why is also this something that's very operational friendly? So walk us through sort of both components, if you don't mind, the patient, why this is approachable, and for a clinic, why this is approachable.
Wonderful, wonderful question. Number one, any person with a pelvis should sit on the EMSELLA chair. This is the only prerequisite. Do you have a pelvis? Because every patient's a candidate. I can start out with the young patient who comes in for whatever reason, and very often undiagnosed, why she needs to go to the restroom every half hour. So much so that she's becoming a recluse, not leaving her home, fearful of leaking if she doesn't get to a restroom quickly enough, yet sitting on the EMSELLA chair, number one, fully clothed. Number two, painlessly. Number three, quickly. She can get a treatment in 28 minutes. Nobody knows why she's at the office. And all we hear is ding, 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 which of course is the sound of money, because it doesn't take our time as a physician, my front desk person can put my patient on the EMSELLA chair. Once I've trained her how to find the EMSELLA spot, we call it the EMSELLA wiggle, and you find the location, and she can turn on the power and the patient's on her own. So it doesn't take my time, and that saves me money because I can be making money in another room or be on a webinar. So it's non-invasive, and the patient walks in, walks out. Again, anybody can put them on the machine. Not only that, there's no consumable. And we know consumable also means money. So when there's no consumable, what I love about that feature is not only that it's going to, once I buy the device, I have it forever and it never is going to die, but it also enables me to use it as a teaser. Okay. So right there, I can say to the patient, I ask every single patient if they're having any issues with incontinence, if they're running or have urgency, frequency. And if they say yes, I say, I have a perfect device. You should give it a try. And free, just sit on it for a minute, at least get to see how it feels. Very often they do not want to get up and they do their first treatment right then and there. So it's a beautiful feature to have because you don't hesitate to use it as a teaser and a way of engaging the patient.
Carolyn,
You've touched on something very important, and Dr. Brandeis, I would love to hear also you, but you mentioned something very important, Dr. DeLucia, which was it's you can demo this. I mean, what medical procedure have we been able to give a test drive, right? And that allows for patients that are hesitant, that are fearful. We can almost not even say anything. It speaks for itself. But Dr. Brandeis, I would love to kind of hear a little bit more from you as well.
Yeah, I mean, I totally agree with what Carolyn said. And one of the advantages is that the results come relatively quickly. I mean, if you're doing Kegel exercises, you're going to suffer for 6 to 8 to 10 weeks before you begin to start to get some benefit from Kegel exercises. Whereas with the EMSELLA, after 2-3 treatments, I've seen patients have fairly significant improvements. So the HiFem technology is able to hypertrophy muscle a lot quicker than you could do in the gym.
100% right. Yeah, it's something that, in today's world, people are on the go. They want quick results. They want them now. They're working, they're staying in school. People are very active. So downtime is not a thing anymore. Quick results is very much a necessity in our practices. This allows us to accomplish that. One thing I want to kind of transition to, and Dr. Wallace, Dr. Brandeis, both of you have been very influential in a lot of sort of the studies that have been performed when it comes to the EMSELLA technology. And we know that BTL is very rooted in proving things with data, with science, with results. There's no claims unless they have actually done their due diligence. It's what I personally, and all of us probably agree on this, is that BTL is so dedicated to patient efficacy through results, through clinical trials, and through studies. They have the most amount of peer review and clinical studies of any company. And here is kind of the discussion I want to kind of segue into. Can you both walk us through, Dr. Wallace, Dr. Brandeis, on this tradition that BTL has for their 3 decades of being around, and how we can see that when it comes to the EMSELLA and the science that has been developed behind that and what the results have been, if you don't mind?
Sure. I mean, I can start, just the breadth of conditions that they've looked at with EMSELLA alone speaks to the fact that, having a strong pelvic floor impacts almost every aspect of our life. I mean, initially looking at urinary incontinence in women and then sexual function in women, hitting across the board all 5 parameters of improving sexual health in women. I think the most amazing thing that I like about what's been studied is really looking at the comparison of EMSELLA to traditional physical therapy and Kegel coaching or pelvic floor training, and then looking at functional electrical stimulation And for those who don't exactly know what that is, women would traditionally go to physical therapy and they'll be coached on how to do a pelvic floor exercise, but you really can't assess that very well unless you take your pants off and someone's doing somewhat of an invasive exam and having you squeeze around a biofeedback monitor and or actually inserting a probe that does electrical stim to the pelvic floor muscles. EMSELLA, fully clothed, sitting there comfortably watching YouTube or your phone, showed not only that it was a more desirable, satisfactory treatment, but actually was more effective than pelvic floor training alone, and then more effective than functional electrical stim. So that's one of my favorite studies. Certainly combining it with other modalities for sexual function has also been, a big game changer in my practice as well.
Yeah, I mean, I remember the first time I tried EMSELLA at a meeting, and I sat down on it. Within 2 seconds, like I intuitively understood what it does. So, I mean, on one hand, it's great that BTL does all these studies to actually prove that it works. But at the end of the day, the patients don't have to read the studies. Within a couple of minutes, they actually can really experience what's going on, and they really understand intuitively what it's doing and how it works. And a lot of my patients that do EMSculpt, especially the ones that are athletes, they'll all start laughing because they get what it's doing, and they're thinking, I've been working my butt off in the gym for all these years, and all I have to do is lie down and have the machine do the work for me. And that's the beautiful thing about the EMSELLA is you don't have to go blue in the face till you're doing Kegel exercises all day and all night, and every stoplight, and every time someone flushes the toilet, and all these little things that we used to tell patients to do to have them remind them to do their Kegel exercises. They just have to sit down, do 28 minutes on this machine once a week for 6-10 weeks, and they're good to go.
Absolutely. No, you're absolutely correct. Dr. Kaplan, I would love to kind of hear about your sort of early impressions as you looked at technology and EMSELLA became something of a highlight for you. And as you integrated this technology, what was it that intrigued you about sort of why this could help or how this could help patients and the science to back it? Because let's face it, all of us are skeptics when we first are approached with different options and opportunities. What was your first experience as you brought on EMSELLA? What intrigued you? What excited you? And how has it transformed your practice today?
Well, I'm just going to sort of say, first, I'm kind of known as the hormone doctor, and then got into a lot of the sexual health. And one of the biggest complaints I get is I lost my libido and I want it back, right? And so I did a lot of the, technology out there for vaginal rejuvenation, doing different RF technology. And then, my company that I was using went belly up. And then it was like, oh, I need to look for a new device. And that's when I got introduced to BTL. And, I looked at the MFEM, and it and then it was, EMSELLA. And I kind of quickly learned that everything integrates perfectly together. It gave me the outcomes that patients were thrilled with. And I'll talk later in the talk about how I layer things, and like you say all the time, big, better, best, okay, we can do this, this, or this. EMSELLA was a bit of a no-brainer. Stress urinary incontinence is huge. Sorry, we'll talk about incontinence is huge. Stress urinary incontinence is huge. And, I think I would say me and a whole, good part of the medical profession would think more women. But then, I realized, well, men are equally part of this equation, because yes, they can have prostate cancer and have a prostatectomy, and nerves can be damaged and the pelvic floor can be damaged. But I didn't realize that guys working out and lifting heavy weights can blow out their pelvic floor just like women delivering a baby. And so, when you don't ask, you don't know, and then you start finding out. And basically what I'm going to sort of say, that it was very easy for me to incorporate the technology into my practice, because I have all these patients, right? I do, basically hormones, wellness. And then, asking patients, starting with questionnaires, who has stress or urge incontinence, who has, erectile dysfunction, who has, people who doing weight loss programs lose muscle mass. So like all of these things are so important. And then it very quickly became, oh, this is actually a wellness device, not just about, urinary incontinence. And then I'll talk in 1 second about, the new indication for sexual health, but also like the other physicians had talked about, that it strengthens your pelvic floor, which is 50% of your core strength. And this, muscle matters at the end of the day. The more muscle we have, the less fragile we are, the less it helps with balance and lower risk of falls. So at the end of the day, we're healthier and should hopefully live longer. So,
and one thing that, I love what you're saying about how this will help so many things outside of urinary incontinence and outside of intimate health. This is truly a urinary incontinence way past that in terms of quality of life technology. This improves quality of life, and we're able to bring back someone's ability to spend time with their kids out on the field or go on a boat trip and not worry about the restroom. How is that impacting their mental ability? They're more emotionally happy, they have better relationships. And so I appreciate the conversation. Of course, we're all fans of this. It's pretty clear that we're very raving fans of the EMSELLA technology, but we're not the only fans. I think that social media is something that I would say out of any technology company, BTL has been very dialed into optimizing social media, utilizing social media, because the beauty of these technologies, they're very show and tell friendly. We can show them off. They're not things that have to be censored. They're not things that have to be kind of behind closed doors. We want people to enjoy and share their experience. And BTL is so committed to propagating all of this on social media. And social media is something that our patients are on. They're looking for comfortable treatments. And I think that when we see patients raving about it, that makes us much more exciting. So, we can talk about it all we want, but I think the patients themselves are out there posting about it, talking about how popular of a treatment this is, and it being sort of a reel of opportunity. And I want to be able to kind of move towards a video that I believe we have, and it highlights sort of the impact globally that the media has now seen with EMSELLA. And so I think BTL here is going to cue us a video to help us.
Chair has just been cleared for new use.
Oh, yeah. Health anchor Liz Bonus joins us now to share just who it might benefit. Liz.
Hey guys, good afternoon once again. You may recall a few months ago we shared with you a new form of restroom relief, you might say. It's this chair. It's called the BTL EMSELLA, and it works to lift the pelvic floor by forcing what sort of feels like intense Kegel exercises.
Hi, I'm Alice Hart-Davis, and this week's Tweak of the Week is the EMSELLA chair, which helps build the muscles in your pelvic floor. So I'm at the Rita Rakes Clinic, and I'm going to go and talk to Dr. Galina, Stella's neighbor, about this EMSELLA chair, what it does, and try it out. So come along with me and we'll see how it is.
It affects millions of people, all by sitting in a chair. This chair is reportedly treating urinary incontinence. Urogynecologist Dr. Red Allenside joins us. Number one, does this really work, and how the heck is it working?
Well, this is a revolutionary procedure that really does work and help patients.
And I'm going to start it
tingles.
Exactly.
I feel like little tiny tingles.
Okay, so we're at 25%. How you doing? Kind of lean around and you'll feel it in different areas.
Feel like there's a spot.
Exactly. All right, I'm going to bring it up. Let me know how you're doing.
Just tingles, nothing painful, nothing weird.
And this is your first
session.
And
what percentage are we at?
We're at 42.
You can crank that up, Dr. Suzanne.
Right. Emily from Sex with Emily. I'm at Dr. Gavavi's office, and I'm on the EMSELLA chair. Currently, I am sitting here for 28 minutes, and I'm going to have completed 12,000 Kegel exercises. Love technology. I love the efficiency of this. This has come a few times, and it just changes everything.
Well, now that I've been through all of the 10 treatments, I got to tell you, I am so feeling like 10. If I had more than 2 thumbs, it would be more than 2 thumbs up. Yeah, it's feeling like a 10. I'm pretty happy about that.
Clip earlier in the season, that was Kitty, who was suffering from incontinence issues. How is she doing today? You're about to find out in our doctor's checkup. Kitty, what's the update?
I'm awesome. It was so great. The chair was the best thing that could happen to me.
I hope that gives everyone a good idea of sort of how the media and the rest of the world has really adopted this technology. And I think what I take away is I see a bunch of smiles, of course, of my colleagues here, but I can feel the smiles from around the world that is watching this webinar today. And why was this so important is that a topic that has been so uncomfortable to talk about for patients, a topic that is so difficult to bring up, we can now smile about it, enjoy it, approach it, and actually embrace it. This is what EMSELLA is, and EMSELLA doesn't stop here. As I mentioned at the beginning of this webinar, we have very exciting news to kind of help portray what is the next chapter of EMSELLA, because this book is not done. BTL keeps writing its future. BTL keeps advancing its story of EMSELLA. And I want to help figure out what the next chapter of EMSELLA is. And Dr. Kaplan, can you help share us a little bit more knowledge on how BTL is going past urinary incontinence and the innovation not stopping there, but now continuing specifically, of course, in your home country, Canada? Walk us through this exciting news that we can officially now proudly announce. Walk us through what's new with EMSELLA.
Well, let's just back up. So originally, EMSELLA was FDA and Health Canada approved for urinary incontinence in both men and women, and to treat both stress urinary, urge incontinence, and mixed. And not a lot of modalities out there, medications could address all three, and this product does. But now BTL has now approved or expanded approval on sexual health. So basically, EMSELLA can now be used for to improve or enhance sexual function related to weak pelvic floor, and as well as treating somatic sexual arousal disorder, which is a mouthful. And there's so many of terminologies being used that, sometimes it's hard to go, okay, what is that? So somatic sexual arousal is basically difficulties in experiencing or maintaining arousal during sexual activity. Things that could be included are lack of lubrication, decreased sensation, either due to laxity or nerve damage, or the inability to achieve orgasm. So woohoo that we can use EMSELLA. When we demo EMSELLA, often we'll tell patients to go home and have sex that night and tell us and report back what they thought. And a lot of the patients would come back and, oh yeah, they tingled a little more, because it does increase blood flow. And the other thing to understand that a lot of people go, well, okay, EMSELLA strengthens the pelvic floor. How does that relate to sexual pleasure or the ability to orgasm? And I'm like, okay, that's a good question. So basically strengthening the pelvic floor, so when the muscles contract, it actually increases blood flow to the area. So it helps women with atrophy. It helps men maintain or get an erection, because it helps with blood flow getting trapped in the penis. And also basically with increased muscles, the muscle contractions can increase sensitivity. And also if you have a stronger pelvic floor, that fit, the right fit hits the right spot to help you orgasm. Because of the increased blood flow, there's more ability to get aroused. And also men often, I think, have to concentrate not to go. Women always have to concentrate to go. And I think it's about using those pelvic floor muscles. The more intense contraction that we can do, the better we have the ability to orgasm. So woohoo. And then also when we have muscle imbalances, whether it's weakness or, a lot of women don't contract their pelvic floor properly, and that can also cause discomfort during sex. And then using the EMSELLA, because it works on the neuromuscular tissues, it kind of retrains how things should work properly. So again, way better outcomes. So yeah, very exciting. And One comment I will add at this point too is that, people are always going to gym, want to look better and feel stronger, and they don't really think about their pelvic floor. But yeah, like we should be doing pelvic floor therapy all the time and be proactive and be preventative, because once they're too weak as we age and everything, it's much harder to get back than, somebody who's just had a baby and things are just starting to be stretched, and in a good time, like, postpartum is a good time where there's a little more recoil. And if we actually did training at that time, we would get better outcomes. The same thing, that guy lifting really heavy weights, if he did EMSELLA at the same time, he wouldn't blow out his pelvic floor, and he would be able to lift better weights, right? So
Absolutely.
so many
No,
benefits.
I'm very excited about BTL's dedication to obtaining more clearances, because we want to make sure that patients have full confidence. And certainly we have confidence behind the technology, but the reputation matters. People want clearances. They want indications to be actually studied and released. And now we have this opportunity to talk about intimate health and actually show that we have clearances for it. And I think when we look at sort of what sexual dysfunction means in the landscape of it, this sort of really is exciting for patients, but I think it's equally exciting for the growth and expansion of our own practices, because now we can have this entire avenue of opportunity, avenue of conversations, avenue of success with our patients. Sexual dysfunction is obviously affecting over 50 million people. As you can see here in North America, it's slated to have over 80 million. And the average population age for this is 45 years old, and people are in their prime years of life. And as you mentioned, Dr. Kaplan, we got to actually have conversations proactively. Let's be preventative, not reactive. Let's be proactive. And I think now we can actually do that to prevent the side effects or the issues of sexual dysfunction, not just strength, stability, and urinary incontinence, but also intimate health. So as we look at this marketability with $8.1 billion spent annually on sexual dysfunction, a lot of that's it's very reactive. It's having pills or having other things that are really, of course, helpful. But if we can bring this in early, right after pregnancy, previous to pregnancy, and help build a good foundation lifelong, I think pharmacotherapy then will have less of an impact. We need medications, of course, but figuring out how can we prevent that? How can we actually go down to the foundation, which is the longevity of our health, which is muscle, the currency of life. So as we kind of continue our conversation here, I would like to kind of talk about why this is so important. And we know here that 2.8, almost 3 patients, more patients we have to ability to talk to. We have 133% increase in opportunity in our practices. So as practice owners, we want to have amazing results. We want to have the best tools to give them amazing results. And we want those tools to obviously be advantageous for the patient, but also advantageous for us, because we all work very hard to build our network, build our practices, and we all deserve to build our opportunities, the growth of our practice, to hire more team members, expand our location, build another location. Whatever that mission is that you have, we need revenue to do that. And if we can have a foundational treatment that not only provides amazing results, but consistent revenue with no consumable, it's very hard to debate that this is a beautiful business opportunity, a growth opportunity, coupled with this transition and crossroads of the demand from patients. People want this. And now if we have it, it's a beautiful synergy of they get results, we get growth. And I think that is partnership with our patients. So I'm very excited about that. I want to transition sort of our conversation into our next slide. And that's going to be about, the correlation between intimate health or sex and urinary incontinence. Dr. DeLucia, if you can walk us through sort of merging this wellness and vanity together and walking us through why this is so important, not just for patient care, but for us to converse about, and how do we intertwine these conversations together, if you don't mind.
My pleasure. I will tell you that the first time I did my first 6 treatments on the EMSELLA, I finally could go out with my girlfriends and not have to cross my legs if we were cracking up laughing because tears would run down my legs. We all knew it wasn't tears. So when that happened, I also noticed, I think that orgasms are better as well. So I went to BTL and I said, I think we need to do another study about sexual function. And so we did. And sexual function with muscular contraction, everything's about blood flow when it comes to male sexual function and female sexual function. And anything we can do to improve on that is going to impact our sexual response. So my key, and what I will also echo, is that postpartum, women should be trained immediately. Maybe we wouldn't have our uteruses dangling between our legs if when we had a baby right after, we were rehabbing those tissues appropriately with the EMSELLA chair, building back that muscle tone that got stretched and damaged during a pregnancy and birth. Post-menopause, let me just tell you, everything thins out, dries up. If we can increase blood flow to the area, that's going to make a huge difference. What I find with men, very interestingly, is that they don't even realize they're having urinary incontinence. I don't know many men over 50. If I ask them how many times they wake up in the middle of the night to use the restroom, it is, I would say, 95% of men wake up at least once, if not more, to use the restroom. That's a sign of urinary incontinence in men. And they're not even aware that that's what's happening. By sitting on the EMSELLA chair, they will see improvement and ability to sleep through the night. And post-prostatectomy, of course, is a huge impact. Men needing to wear diapers for months after that procedure. If they can tighten up those muscles that Dr. Brandeis was so beautifully and eloquently describing, how incredible is that by simply sitting on the chair? So all of these conditions that cause urinary incontinence and sexual dysfunction affect all of us. Aging, whether we like it or not, it beats the alternative. We got to age or we got to die, right? So those are the choices we have. Vaginal deliveries, if that, of course, weakens the muscles, menopause, as I mentioned, and damaged nerves from surgeries in both men and women, just enlargement of the prostate, let alone removal. So all of these conditions can be impacted.
Dr. DeLucia, you walked through a great sort of summary of all the different types of use cases, right? It's not just younger individuals, it's not just elderly, it's not just men, it's not just women.
Correct.
It's so many different types and so many different opportunities and different conversations that I can only assume and bet on that we have every single day. That we see these patients every single day with one of these concerns, if not multitude of them. And now we have the opportunity of talking about it with confidence because we have a solution that confidently provides results. And as we understand this a little bit more, can you walk through sort of yourself and Dr. Brandeis together, if you don't mind, kind of walking through a little bit of the statistics? What are some of these things that we're seeing? I know we've mentioned them, but let's kind of course, as in BTL fashion, let's back it up with some science. What have we seen? If you guys both don't mind sharing that with us.
Oh, our pleasure, I'm sure. So I'll do the female side really quickly. What we discovered is that for sexual satisfaction and desire, there was a 76% improvement in our study. Not only, like I had said, something was better. So indeed, that proved out 60% improvement in orgasmic function. So that is quite remarkable. And what do you see in men?
Well, first of all, it's very reassuring for me to know that we spend $8 billion on sex and only $6 billion on diapers. So first of all, that really makes me happy. But for men, it affects a number of things. First of all, it helps improve blood flow. And I believe in multimodal therapy. So supplements, PDE5 inhibitors, shockwave therapy, PRP, stem cells, and EMSELLA. It's just another thing that can improve the blood pressure inside the penis. And in my study, we used microvascular ultrasound, and we saw that it improved the tissue structure in the penis. So it was able to create new blood vessels in the penis. But also, very importantly, it improves the strength of the bulbocavernosal and ischiocavernosal muscles, which create that contraction in the urethra that propulses the semen forward, so it improves ejaculation. And in certain subpopulations like homosexual men, that's super important. In addition, I have a lot of homosexual men that will come in because you can strengthen the rectal sphincter. So the same way that you strengthen the vaginal sphincters and the walls of the vagina, in homosexual men, that's really important to be able to control and increase the intensity of the rectal sphincter.
Absolutely. I think that those sort of opportunities are things that we now have the opportunity of addressing. And we can speak to our sort of male population a little bit more. Can you walk us through, Dr. Bernays, a little bit more about the specific highlights from this study?
Sure. So in my study, we used 20 men, and we put them on the machine once a week for 10 weeks. And we did the SHIM score and the IIEF score, so the International Index of Erectile Function score, and also the AUA symptom index, which is a urinary symptom score. And what we found was that across pretty much all the domains of the IIEF, the International Index of Erectile Function, there was improvement, including improvement in hardness or erectile function, and also in ejaculatory or orgasmic function. And we also had improvement in urinary function. And I think that eventually we're going to get around to do the study that shows that the EMSELLA chair actually improves the detrusor muscle, the muscle that causes propulsion of urine. And in women, that's sort of important, but women can void by Valsalva, by pushing down. But in men, because men have prostates, it's much more difficult to urinate by Valsalva. And so a lot of men have what are called hypotonic or weak bladders. And this would be amazing because it would be the first treatment modality ever to increase the strength of the bladder. So across the board, orgasms, ejaculation, hardness of erections, and urinary function, EMSELLA is a totally non-invasive, easy treatment that improves all those different functions.
Love that. And then Dr. DeLucia, if you don't mind kind of walking us through the study in regards to what we see here, the one that you were a part of, and kind of a little bit more detail, if you don't mind.
My pleasure. So there were 31 women in this original trial that just focused on the EMSELLA. The patients all had to have sexual dysfunction in addition to urinary incontinence. And what we ended up seeing is that using the ICIQ-UI, that 68% improved. That's quality of life, urinary incontinence scoring, and it's the sexual dysfunction straight across the board in all the parameters, whether it be improved tone, improved lubrication, improved intensity of orgasm, and even libido, which is an indirect effect. But if it feels better and it's comfortable, women are going to be more willing and more excited about being involved in intimacy. So we've seen this around 50% improvement straight across the board in all of the parameters.
I appreciate you sharing that data because it's so important for us to understand sort of what did it look like behind the scenes when producing these studies. And we appreciate both of you, Dr. Brandeis and Dr. DeLucia, for walking us through that. I want to kind of segue into how the pelvic health completes your wellness offering. Now, wellness is a terminology that has always been around, but I feel like over the last 2-3 years, it has exponentially grown. People are Googling wellness when it comes to intimate wellness, when it comes to muscle wellness, nutritional wellness, mental wellness. And I think wellness is this ongoing conversation that's going to continue to be had. Dr. DeLucia, I wanted to kind of quickly get your take. Would you agree that the pelvic health is now providing a major impact on the overall well-being for wellness? I mean, we talk about intimate health, we talk about urinary incontinence, but what about wellness, the bigger topic above? Walk us through sort of this new wave of wellness conversation, how EMSELLA fits into that wave.
Okay, well, some of the impact that we really want to bring up here are the psychological effects that occur when you have a weakened pelvic floor. These issues can be simply from having prolapse, or it can be women can feel a bulge coming down, and these will have an impact on their confidence and increase their stress disorders and feelings of hopelessness. They feel that they can't find a solution or speak to it. So that's the saddest part, is that there's always been a taboo on the topic. And a lot of women will come to me, I'm feeling something, I don't know what it is. It happened overnight. Well, we know it didn't happen quite overnight, but all of a sudden they will become aware of it. 45% of women who have urinary incontinence will not be intimate with their partner. That's for this stress that's occurring because of the condition. So with that lack of confidence and fear of leakage, they will not participate in sex. And if something that we can do, we have to ask the questions as providers. We have to ask whether or not what's happening to them is impacting their quality of life. And when this occurs, we've got to address it and have answers. And finally, we do, which is why we're hearing much more about overall wellness. Not only that, we're living longer. A baby born today has a life expectancy of 120. So when we think about everything we can do, the tools we have to live longer and live better, number one is sarcopenia has got to stop. So we have to be able to maintain our muscle mass, because without muscle mass, and the cradle of civilization, again, is where it all begins, and it's tied into our abdominal wall, which supports our back muscles, which supports our ability to stand erect. If we can't function, we can't live, and we can't accomplish the activities of daily life. Sarcopenia is the #1 cause of nursing home admissions. So all of these aspects affect our quality of life. And if you can't have sex, why live?
That's a perfect end to that conversation. I want to talk about complementing the other treatments, because EMSELLA is not here to replace anything. It's certainly here to enhance everything, to help enhance the different things that we already provide, the different treatments, the different modalities. So Dr. Wallace, I know that you're huge about looking at the pelvic floor, not just as the pelvis, but also the core to floor concept, why that's so important to help introduce this concept to both not just the pelvic floor, but also the core, the aspect of other intimate health and strength and conditioning and stability. How does this complement the sort of things that you do? How does it enhance all the other things you do? And how have you connected with this concept of core to floor?
It just sort of comes full circle. I mean, my background is, I've been lifting weights since I was 15. I'm a hot yoga instructor. I have patients. My youngest patient on the EMSELLA is 16 and my oldest is 106. So I look at my patients in a very different way. I'm starting to see that group with the walkers who are bent over and cannot get up out of a chair in the reception area. And I'm thinking, gosh, we needed to get you so many years ago. So I am not waiting till women are pregnant. I'm trying to get the word out there that we need to build our pelvic floors way earlier. And my 16-year-old happens to be a runner. And people may not know that all the track girls pee their pants. All gymnasts pee their pants. Marathon runners pee their pants. And so if we can actually educate about the pelvic floor strength and it being the foundation of that core and that stability before we even go around and get pregnant and have babies, and then even pre-surgery, the wait time to have surgery with me is 2 months, maybe at the earliest. So I'm like, well, we have data that if you go to pelvic floor therapy and do Kegels before surgery, you have a better outcome. Well, why not be on the EMSELLA before surgery? Because we're going to have a better outcome. I had a patient recently ask me, a friend, my doctor said, just do the EMSELLA after I treat my prostate for my prostate cancer. I'm like, no. Why would you want to treat damaged nerves and muscles after? Let's get you strong before. Your surgery is not for another 6 or 8 weeks. So I think about it as how can I address that foundational strength? Because we know that physical wellness is the foundation of all the other wellnesses. And when I look at patients now, I'm like, let's look at head to toe. How can we stabilize you, prevent falls, enhance your continence, enhance your sexual function, enhance your athletic performance? So when I look at my patients now, it's all about how can I build muscle from head to toe. Core to floor strength involves the abdominal muscles, the long back muscles, the glute muscles, the pelvic floor muscles, really addressing that overall, core, abdominal wall, back, glutes, pelvic floor, and that stability that's over the trunk. It's going to keep us upright and walking, reduce our risk of falling, helping us get up out of a chair, helping us balance. And BTL has done the studies, and I'm so excited when I talk about the core to floor studies because they actually looked at parameters that physical therapists look at to measure core strength, not only a biometric mat to measure core strength in both postpartum and in more senior population, but also in being able to stand on one leg, to stand up from a chair and go across the room, the speed of gait. That was all looked at using EMSELLA and EMSCULPT combination therapy, which is called core to floor therapy.
And this core to floor concept is an entirely a functional medicine conversation. If we think about it, I mean, we're improving the function of how we live our lives, quality of life, as we've mentioned. And so the versatility of how this fits into so many opportunities, intimate health, urinary incontinence, stability, strength, function, quality of life, it's endless, but it doesn't end here because Dr. Wallace, I know that you have this other concept that you love doing for your patients, and that's the combination treatment of EMSELLA, but with also EMFEM 360. Walk us through just quickly kind of what that combination looks like. What is this combination? Why this combination is so vital?
Sure. So pelvic power or sexual wellness is how I like to call it. You get to treat the soft tissues of the feminine area, both the internal vaginal canal and the external tissues with radio frequency with EMFEM, which is once a week for 3 weeks. And lo and behold, you can have 2 EMSELLA sessions once a week for 3 weeks, and you're done with your entire treatment. And what's amazing is you're treating the muscle, the foundation, which is going to help us with our continence, our orgasm, our arousal, our desire. And then the EMFEM, which helps with lubrication, actually treating under the neck of the bladder. I always talk about it as being a little energy sling because we're restoring that pubocervical or that adventitia, which is this thin little fascia that's under the neck of the bladder that gives this little lift. That not only helps with continence, but it actually increases blood flow to the clitoral region, to the periclitoral tissues, to the G-spot, which is in the urethrovesical junction area, which is just going to enhance our sexual function, our elasticity, our grip, our sensitivity, our orgasm. it's a game changer when you add the two technologies together. And I know that Dr. DeLucia and Dr. Chaplin can also speak to that as well.
Absolutely. We're actually segueing right to them. So that's perfect. Dr. Kaplan, Dr. DeLucia, walk us through not just sort of this concept, but also carrying into the concept of how we intertwine this with another layer, hormone replacement therapy, O shot, P shot, delivering this holistic approach with invasive, but also minimally invasive and then non-invasive. We have so many opportunities in connecting all the dots together. So now we have cortifloor, we have pelvic power. But how does that combination look like with O shot, P shot, HRT? Dr. Kaplan, Dr. DeLucia, both of you can tag team on this one.
So I like to, again, like you always examine your patient, you want to know what their pain points, what their concerns are. But generally, if someone will talk about, postpartum or perimenopause, menopause, so if they have incontinence, laxity, and stuff like that. And also, what did I say? My biggest complaint is loss of libido, right?
Yeah.
So I like to address all of those things. So hormones in the perimenopause and menopause is really helpful to rejuvenate the tissues and the whole body and mind. But and also you can use estrogen locally to help with lubrication, but I like working on the different levels. So the way I kind of put it together is, okay, I'm going to use EMSELLA to support the pelvic floor muscles. Then I want to work on the tissues with MFEM. And then I'll incorporate the O shot. And in my mind, the O shot is like the only thing I really know that makes a huge difference in terms of women's desire and libido and ability to orgasm. Besides testosterone, but testosterone can cause hair loss for a lot of women, but the O shot doesn't. So I like to kind of do all three of those, plus the hormones if appropriate. So kind of, again, depending on patient's budget, but the ideal would be to work on all of those things. And then you get the greatest outcomes. And they call me Dr. Oh my God for a reason. So
I love that. Dr. DeLucia, what's your take on it?
Well, I think that combination therapy is where it's at, and that's what can set you apart. So being able to use an entire gamut of devices and treatments in order to address the entire patient's sexual wellness is where it's at. Regenerative medicine is growing leaps and bounds, and using now autologous exosomes, for example, to boost a O shot or a P shot. Absolutely incredible. I mean, exosomes are really the future of what we have at our fingertips. So I think that being able to enhance sensation by causing new nerve and blood flow to the genitalia, and that's basically the main way, is with regenerative therapy and increase in blood flow. So those combinations are a win-win. I was blessed to do the pilot study on MFEM, and the beauty of MFEM 360, number one, it's an upgrade on radio frequency. It's a monopolar device that takes 8 minutes, and that's doable. Spending a half hour with a toothbrush going in and out of the vagina is just weird. So having the MFEM for 8 minutes is very doable, very tolerable, and because it's treating 360 degrees, it's delivering amazing energy in a very safe and efficacious, painless way. And both of these devices, all three, if you include regenerative medicine, MFEM 360 and EMSELLA, there's no downtime. They can go home and have sex. You can leave the room and they could have sex. So there's no downtime. And that speaks for a lot, because a lot of people are still shy about having to treat their sexuality. And if they don't have to tell anybody and could go home like they didn't do anything, there you go. I mean, it's the answer.
I love that. And I know we're getting late into the evening for some of you folks, and we promise we're at the tail end of it, but it only gets better. So do not sign off. Otherwise, you're going to miss out. So we're going to make sure that we wrap things up with a beautiful end to this as we get into the last conversations. And these last conversations are big ones. So don't you sign off. We're talking about GLP-1s. Dr. Brandeis, GLP-1s have been amazing for the world, and they've provided a lot of opportunities for patients to get healthier, reduce weight, but they've also provided some challenges along the way. We've noticed some changes with muscle. We've noticed some changes with protein intake. And as a result, people are starting to lose this sort of density and tonality of muscle, not just with their face, not just with their butts, but also their pelvic floor. So can you walk us through a little bit more about the utilization with GLP-1s and how we're having these conversations with that crowd as well? I believe you're muted, just in case. There we go.
Awesome. I do body composition scans on all of my patients. And so I see how much muscle they're actually losing. And when we first started using GLP-1s, I became acutely aware of this. And so I really focus on my patients on increasing their protein intake, making sure they're working out. But working out the pelvic floor isn't quite like going to the gym. And it's one of those muscle groups that's really neglected. And so that's why it's so critically important to use EMSELLA to build the pelvic floor while you're on GLP-1s, because especially on men who are more vulnerable to the effects of loss of pelvic floor muscle, like post-prostatectomy patients or elderly patients, it's really a big deal.
Definitely. It's huge. And it's a conversation that we are now having more of because GLP-1s continuously are more sought after, and they are more really impacting our nation and our country and our world, for that matter, in the weight loss arena, but now, and of course, the muscle arena as well. So I know that we are kind of proceeding here, and we have a lot of other things that we definitely wanted to go through, but the things that we are going to leave out for you guys to go watch, we're going to be posting it on the BTL social media platforms. And what we're going to be posting are the testimonials, the videos, the testimonials, the conversations. And that's something that we don't want you all to miss out on. So BTL is going to be posting that, and go watch it, because you can hear from us, but we need to hear it from the real people, the patients, the people that receive these treatments. And yes, maybe all of us are patients too, but the ones that we treat every day, the ones that inspire us to be the best every day. Without further ado, I want to go through a few questions because they're big ones. And let's go through some of this one. Let's take this one. I like this one. How do you respond to pelvic floor physical therapists who say not all dysfunction is weakness? Some are just too tight. How do we have that conversation? And this is really just open to anyone. What are your thoughts?
I can start with this. It's interesting because I think the pelvic floor therapists in my area are still really gun shy about EMSELLA when in those hypertonic patients. And hypertonicity really just means a shortened muscle in the pelvic floor, because those muscles are really spanning between two bones that don't have a lot of mobility. So I always describe it as TMJ in the pelvis. And I think that EMSELLA, because it re-educates the pelvic floor and it contracts all of the muscles and relaxes all of the muscles, is a great modality for these patients, but I do it very differently. I actually tend to start them at a lower frequency and for 15 minutes at a time if they're a super hypertonic patient. So someone who's having pain as a result of hypertonicity. Because if you're hypertonic, you're not strong, you're weak, because you're in a constant contracted state. So I tend to treat those patients. I spread out their treatments, 15 minutes, less than 50%, as they can tolerate that, meaning it doesn't flare them. If they're more of a pain patient, then I'll actually go up. And I've had really good success with that.
Everyone write that down. That was brilliant. I think that we have to understand that we shouldn't be scared of patients with this. You said it's a weakening of the pelvic floor. Let's strengthen it. We just got to take a little bit more of a, hey, like you lift weights, 5 pounds, then 10 pounds, then 15 pounds. And that's sort of the progression. And I love that sort of protocol. Dr. Brandeis, this one I believe should be for you, and really anyone else that can chime in with their experience on this one. But post-prostatectomy patients beginning treatments, when should they start? When's too early? When's sort of the rule of thumb? And I know this varies patient to patient, but sort of what have you seen?
I would say 6 to 8 weeks. So when you do that anastomosis, you use suture that usually absorbs by about anywhere from 2 to 4 weeks. But to make sure that you're not really injuring the anastomosis, which is critically important for healing, I would say about 6 or 8 weeks.
How about postpartum for the rest of the team here? Postpartum, what does that look like in terms of how soon? And of course, we understand there's variability depending on each patient, but generally, what have you seen?
I don't deliver babies anymore, but I would say the same thing. Dr. DeLucia, would you say about 6-8 weeks?
I would definitely say 6 to 8 weeks, but also if they're breastfeeding, we don't do it. Not that it'll have any impact whatsoever, but just because if the kid doesn't get into Harvard at 21, it could be our fault. So it's when it comes to obstetrics, you be a little bit more on the cautious side.
Sure. Certainly, if they have an active wound that's healing, whether it's a pelvic floor surgery or a postpartum, repair, if they've been cleared to have intercourse, they can sit on the chair. So I suppose that's kind of my guidelines.
A few more big questions that I get asked a lot, and I certainly want to ask you all. Let's get to that question. Prolapse bladder. Does anyone have experience with treatment of women with prolapse bladder with the EMSELLA? How does that sort of conversation look like? Is that something anyone's embarked on?
Sure.
Dr. DeLucia, Dr. Wallace, either of you, what's your experience?
Well, first of all, there's no risk. If someone has a prolapse and it's even sitting beyond the vagina, it's not going to hurt that person. But I'm always realistic about expectations. If the prolapse is beyond the opening of the vagina, it is unlikely to restore that, because that is a true soft tissue breakdown at that point. So, there's no contraindications, but also expecting, sort of realistic results when you have a prolapse in the vaginal area.
I would
Dr.
say also
DeLucia,
using
yeah,
combination therapy also may be helpful. Like some people are like, I'll try anything to avoid surgery. So maybe incorporating MFEM at the same during EMSELLAs and seeing how they're progressing.
Absolutely. With the stage 2 or above, it's going to totally improve that tissue and pop it back up inside for sure. I mean, it's going to help.
I've heard different people do different things, like maybe use 4 treatments of type 1 and then switch over to the sexual health. I don't know.
Yeah.
I only moved to protocol 2 if someone's urinary incontinence, specifically stress incontinence, hasn't specifically responded to protocol 1. I think most women get improvement with protocol 1 with sexual function, and all the data is based off of that, but it doesn't limit me from trying protocol 2 if we're wanting to get maybe a little further efficacy.
So I used to be a female pelvic reconstructive surgeon. So I know a little bit about this stuff, and there's a muscular damage, but also there's connective tissue damage. So if you're talking about a grade 2 or greater cystocele, really it's a connective tissue issue. And so you can do Kegels or EMSELLA to your blue in the face. It's really not going to fix the underlying problem, which is a connective tissue problem. What you're really focusing on with the EMSELLA is a muscular issue. What can we fix by increasing the strength of muscle? You can increase detrusor contraction. You can increase contraction of the ischiocavernosus and bulbocavernosus, the ejaculatory muscles. You can increase the strength of the muscular tissue below the urethra and help with improved stress incontinence. But anything where the connective tissue is torn up, you better not treat these patients.
Well, they're not going to get better. It's okay.
Right. You won't do harm, but you're not going to have a patient that's, calling you doctor.
I haven't even reached the subject of anal incontinence because I want to do that study, but I'm telling you that the external anal sphincter is part of the pelvic floor. And
absolutely. And it works for that too.
It works.
On the next webinar, when we get those clearances, we'll do that on the next webinar. We promise. So I love that. Yeah. Well, listen, guys, I have 3 groups of people that I would like to thank. Most importantly, BTL for organizing this amazing webinar, giving us the opportunity to continuously learn. This is their dedication. They're dedicated to teaching. They're dedicated to science, and they're dedicated for making this industry and leading this industry every time. Second group of individuals are speakers. Thank you so much for spending your time in the middle of the night, for many of you, for dedicating yourselves to perfecting the science, perfecting patient care, and making this industry what it is today. I respect and highly appreciate all of your time. And the last group is all of you tuning in. You all have dedicated your times to come be a better provider, be a better clinician, be a better physician, nurse practitioner, whatever your expertise is. You have joined us to help perfect that and help lead this industry with BTL. And we thank you so much for that. As I mentioned, there's a survey right after this. Thank you all. And that is all for this evening, this morning, wherever you are in the world. We appreciate you. We respect you. And thank you for always being a leader in this industry, just like BTL is always being a leader as well. Thank you all. Good night. Good morning. Take care for now. Bye-bye.
Thank you, Dr. Patel. Bye.
Take care.
Thank
Bye,
you.
everybody.
Bye.